Hello everyone, welcome back to our channel Dentistry of Two Minds. Let's start with the dental anatomy, which is a first year exam going subject in BDS. We will be starting with the introduction of dental anatomy. The field of dental anatomy is dedicated to the study of teeth, including their development, eruption, morphology, classification, nomenclature and function. The dental occlusion deal with the contact relationship of the teeth in function as in mastication and also in the static morphological tooth contact relationship as at rest. The knowledge of dental anatomy, physiology and occlusion forms a firm basis for all the fields of clinical dentistry and is essential for rendering appropriate treatment to various dental problems. A brief overview of dental anatomy and the related basic terminologies we will be dealing in one or two videos. First, we'll deal with dentitions in humans. Humans, like most mammals, have two sets of teeth, the deciduous or primary dentition and the permanent or secondary dentition. Such a condition where the two generations of the teeth are present in a lifetime is called diphyodonty. Most submammalian vertebrates are polyphyodonts, with many successions of teeth necessary to compensate for continual loss of teeth. The teeth in these animals are directly attached to the jawbone and thus are frequently broken and lost during the normal function. A limited succession of teeth still occurs in most mammals, including humans, not to compensate for continual loss of teeth but to accommodate the growth of the face and jaws. In children, the face and jaws are small, hence can carry only a few teeth of small size, the deciduous dentition. Later, a large increase in the size of jaws occurs in growth, necessitating large teeth. Since the size of the teeth cannot increase once they are formed, the deciduous dentition become inadequate. Thus, they are replaced by sets of larger and greater number of teeth, the permanent or secondary dentition. Let's now talk about deciduous or primary dentition. The primary dentition is called so since there are four sets of teeth to appear in the oral cavity. The term deciduous implies that they are shed, fall off, similarly to the leaves of deciduous forest tree. The primary teeth are sometimes also referred to as milk teeth, baby teeth or lacteal teeth. These terms are unfortunate and inappropriate since they imply a lack of importance to the forced dentition. The term deciduous and primary are more appropriate and are used interchangeably. The primary dentition consists of total 20 teeth, 10 in each jaw. The primary teeth begins to emerge into the oral cavity at about 6 months of the age, and the child will have his or her complete sets of primary teeth by 2.5 years to 3 years. Next is permanent, secondary or succedaneous dentition. There are total 32 teeth in permanent dentition, 16 in each jaw. The permanent teeth are also called as succedaneous teeth or secondary teeth since they replace or succeed the primary teeth. The permanent teeth begins to emerge at 6 years of age and gradually replace the smaller primary teeth. The eruption process is completed by 12 to 13 years except for the posterior most teeth, the third molars, which erupts around 18 to 25 years of the age. Point to be noted here that there are 32 permanent teeth but only 20 teeth in the primary dentitions. Thus, there are 12 permanent teeth, the molars, that erupts into the oral cavity but do not replace any primary teeth. Therefore, in strict sense, the permanent molars are not succedaneous teeth as they do not have predecessors. Next is arrangement in dental arches. The teeth making up Each dentition are arranged in two arches, one in each jaw, the maxillary and the mandibular dental arch. The teeth in upper jaw, the maxilla, are called maxillary or upper teeth. The teeth in lower jaw, the mandible, are called mandibular or lower teeth. There are equal number of teeth in maxillary and mandibular dental arches, 10 in primary and 16 in permanent dentition. Furthermore, the teeth in each arch are arranged symmetrically on either side of the median plane. The median plane that divides each dental arch into left and right quadrants. There are 4 quadrants in oral cavity, namely the upper right, upper left, and lower right in a clockwise direction. All the 4 quadrants carry equal number of teeth in absence of any pathology. The corresponding teeth in left and right side of dental arch are mirror image with similar size and forms. Talking about the classes of teeth, all the teeth in human dentitions are not of same shape. Depending on the form and function, there are 4 classes of teeth in permanent dentition: the incisors, the canines, the premolars and the molars. Premolars are only found in the permanent dentition. There are no primary premolars. Therefore, the primary dentition consists of only 3 classes of teeth: the incisors, the canines and the molars. The incisors and canines are collectively known as anteriors, while the premolars and molars are collectively referred to as posteriors. The origin of words of these dental terms are all from the Latin. Incisors, incidere, in Latin, to cut into. Incisors are called so because their function is of incising and nippling. Incisors are the cutting teeth. Canines, canis in Latin, dog or hound. The canines derive their name from the prominent, well-developed corner teeth in the family. They are also referred to as cuspids, since these teeth consist of one large primary cusp. Premolars. Before molar teeth, the term premolars merely recognizes the anatomical portion of these teeth, that is, in front of molars. They are also sometimes referred to as bicuspids, since these teeth commonly have 2 cusps. Molars. Molaris in Latin, milestone. The term molars refer to the grinding, triturating function of these teeth with their wide occlusal surface. Moving towards the types of teeth. Within each class, the teeth may be subdivided into 2 or 3 types depending on their traits. The incisors are further divided into central and lateral incisors. Among premolars and molar classes, there are first and second premolars and first, second and third molars in permanent dentition. The molar class in deciduous dentition has only 2 teeth, the first and second molars. Here you can see in this picture different classes and type of teeth in human permanent dentition. So today we have covered types of dentition, what are the arrangement in dental arches, what are the classes and types of teeth present in human dentition. In next lecture, we will be learning about the threads, dental formulas, what are the stages of dentition in humans, parts and structure of teeth. Thank you. Don't forget to click on like, share and subscribe button and also hit on the bell icon so that you never miss on updates.